Right now, in order to understand this case, in order to understand this topic on medical negligence, I had selected two leading cases, two leading cases, and this is an old cases anyway. But even if it's an old case, but the principles that we learn from the case is very much relevant to make you understand the concept of medical negligence. I just choose two cases. Maybe in the tutorials later on, we can look to other cases as well. Okay, let us look to the first case that is in page 14 of your materials. The first case is the case of Bolam. Bolams. Alright, in the exam, right, the full name of the case is Bolam against Fian until the end. You can see from the from the materials, Bolams against Fian Hospital Management Committee, 1957, 1 WLR 583. So in the exams, if you can't remember the name of the case full, the name of the plaintiff, the name of the defendant, it's okay if you just remember Bolam's case. So in the exam, it is not necessary for you to memorize the complete name of the party. We just put here Bolam's case. Normally, the case of Bolam's is known as Bolam's case. You just give the name of the plaintiff. So in this case, Bolam's, normally people will call Bolam's case. Right. In Bolam's case, what happened here? I read from the slide, from the materials, right? The claimant was undergoing electroconvulsive therapy as treatment for his mental illness. This patient has a mental illness problem, and he had to undergo the electroconvulsive therapy. Okay. The doctor, in giving this particular treatment, the doctor had not given a patient here relaxant drugs. In giving a treatment, in the process of treating this particular patient, a doctor did not give a relaxant drugs. Whereby relaxant drugs here normally is given to a patient for this kind of sickness, for that particular treatment. That is very common. But in this particular case, relaxant drugs had not been given to a patient. So as a result of not giving this particular relaxant drugs while giving the treatment to the patient here had suffered from multiple fractures. Okay, the patient here had suffered from multiple fractures. So the issue arose in this particular case whether the failure of the doctor to give the relaxant drugs here is amount to the breach of duty, or he had breached the duty of care towards his patient because he failed to give the relaxant drugs. Okay, however, in this particular case, it was argued by a doctor that he had not given the relaxant drugs to this particular patient because there is a risk of death to the patient. Okay, there is risk of death to the patient. So if I give you this particular medicines, even though professionally the medical standards say that this will be given to the patient for this particular treatment, but I would feel that I look that into the case the patient may not be able to take this particular medicines if he takes the risk of death. The risk of death to the patient. For these reasons, the doctor here, the particular doctor, did not give the relaxant drugs because the risk of death is there. Okay. However, in the same case, the other there was opinion saying that if you give in these two scenario, if you give the drugs to the patient, it may cause death. But if you do not give, it may cause small fractures. I repeat, if you give the drugs, relaxant drugs to the patient during the treatment, if you give this particular drug, it may cause death. But it also may cause small risk of fractures. So there are two risks that are actually exposed to the patients. If you give, can cause death. If you don't give, it may cause small fractures. So as a doctor in this particular would take the best for his patient. What is the best for his patient? He will choose not to give the relaxant drugs, because if he does not give the relaxant drugs, it just may cause a small fracture. So that is the lesser risk as compared to cause death to the patient. So because of this situation, he decided not to give the drugs because it may cause only the small fractures. But in this case, the family of the patient here sued the doctor for causing small fractures to the patient. Case. Alright, so when the case go to the court, and the court have to look into the whether all these elements are there, the elements that we discussed earlier. One of the elements that we discussed earlier was that on the professional misconduct, whether is there any professional misconduct by a doctor. Of course, the doctor will have duty of care, and whether the doctor had breached the duty, and whether there was a causation, or whether there was a damages. Okay, we can see that there was a duty of care, right? There was a breach of duty. There was a causation, yes, because of the operation, because of the treatment given by a doctor, then the patient suffered from injury. So there was a causation and there was a damage. But when it comes to number 5, that is about the professional misconduct, whether is there any professional misconduct by a doctor towards the patient. The doctor was saying that we have to see that what is the best, we have to relate to the medical judgment. And we have to relate medical judgment. What is mean of medical judgment? It means that the court look into whether a doctor had taken a very best step in order to protect his patient. So he based his judgment based on the medical knowledge that he has, and also based on the standard of practice among the doctors. When they have this particular situations, what they will do. So in this case, the court held that a doctor was not liable for medical negligence because he had employed best medical judgment according to the standard of practice among the doctors. Because if you have two risks that you have to face, you will take the lesser risk for the best of your patient. So in this case, we will see that basically the case of Bollums, we can say that is a protection to the doctor. Okay, if you read the textbook, if they discuss the case of Bollums, many of them will say that the case of Bollums is actually will be used by the doctor to protect themselves, in order to say that we are not liable to the negligence because we had exercised our medical judgment based on the standard procedure of practice. Maybe you have your own opinion as regard to this. Of course, you will say that yes, maybe as a doctor will use the case of Bollums to defend yourself. But another issue also arose in this case was whether a patient has been informed about the implications of this particular treatment or not. Okay, whether the family members of the patient had been informed what are the risks that will be facing by the patients by this particular treatment. Okay, if let's say you have a patient, patient A for instance, and you know that this patient is very tough, is very strong, then probably you inform him that we have to undergo this treatment on you, but the risks are 1, 2, 3, 4, 5. So you are telling the truth of the implications or the risk where the patients may be exposed due to this particular treatment. At the same time, probably you have another type of patient, that is patient B. Probably patient B is very weak. He is not that strong, or she is not that strong. So if you give him the information, same with the patient A, she may not be able to take it, and it may cause the treatment become worse. So maybe as a doctor, you will take different actions in handling patient A, and you will take different action when you are handling patient B. Okay, so in this scenario, we will see that the doctor is given a fully authority to decide for the best of the patient. Okay, so it means that's why in the case of Bollums, the doctor has been protected. The doctor was not liable for negligence because he argued that I had taken the best action, which is the best for my patient. But maybe some of us will not be happy because it was mentioned in this case the doctor had not informed the patient what are the risks, whereby in that particular situation the patient themselves can choose which risk that they want to take. But still, as I said to you earlier, a doctor, if we are using the case of Bollums, you are protected by this particular judgment. Okay, we will see that nowadays maybe what we call if we can recall, probably if you go to the hospital, a doctor will brief to you, this is the sickness that you have, these are the situations or the status of your sickness, then you have to go for this particular treatment and whatnot. Okay, so maybe you will so maybe you will take a decision whether you want to proceed with this particular treatment or not, because you have a choice. You can make decisions on your own. Nowadays we have this kind of situation, but this was not practiced in the case of Bollum.